Cannabinoids are a group of chemical compounds found in the cannabis plant. These compounds interact with the body's endocannabinoid system, a vital network responsible for managing key physiological functions including mood, memory, appetite, and pain perception. They possess a wide range of therapeutic properties, making them a subject of intense research and interest in the medical community. From pain relief to anti-inflammatory effects, cannabinoids offer potential benefits for a variety of health conditions. Scientists have identified over 100 different cannabinoids, each with unique properties and effects. This diversity makes the study of cannabinoids both fascinating and complex. The two most well-known cannabinoids are tetrahydrocannabinol, or THC, and cannabidiol, or CBD. These compounds have been the focus of much of the research due to their significant effects on the human body. THC is responsible for the psychoactive effects of cannabis, which is why it is often associated with the high that users experience. It binds to cannabinoid receptors in the brain, altering perception, mood, and cognition. CBD, on the other hand, is non-psychoactive and has gained significant attention for its potential medical benefits. It is being studied for its role in treating conditions such as epilepsy, anxiety, chronic pain, and even neurodegenerative diseases. Ancient cultures recognized the medicinal properties of cannabis centuries ago. Historical records show that civilizations like the Chinese and Egyptians used cannabis for various ailments, highlighting its long-standing therapeutic value. Today, there is growing interest in understanding the therapeutic potential of cannabinoids for various medical conditions. Researchers are continually uncovering new insights, paving the way for innovative treatments and a deeper understanding of how these compounds can improve human health.
The endocannabinoid system, or ECS, is a complex network of neurotransmitters, receptors, and enzymes that help regulate a wide range of physiological processes. These processes include mood, sleep, appetite, pain, and immune function. The two primary endogenous cannabinoids, or endocannabinoids, are anandamide, AEA, and 2-arachidonyl glycerol, 2-AG. Unlike classic neurotransmitters, endocannabinoids are synthesized on demand in the postsynaptic neuron and travel backward to the presynaptic neuron to modulate neurotransmitter release. Endocannabinoids are naturally produced by the body and bind to cannabinoid receptors. Receptors are located throughout the body, including the brain, immune cells, and organs. Enzymes are responsible for breaking down endocannabinoids after they have exerted their effects. The two primary cannabinoid receptors are CB1 and CB2. CB1 receptors are primarily found in the central nervous system. They are involved in regulating mood, pain, and coordination. CB2 receptors are mainly located in the peripheral nervous system and immune cells. They play a role in modulating inflammation and immune responses. THC primarily binds to CB1 receptors, which explains its psychoactive effects. CBD has a low affinity for both CB1 and CB2 receptors. Instead, it interacts with other receptors in the body, such as serotonin and vanilloid receptors. THC overstimulates CB1 to create euphoria and sometimes anxiety, while CBD modulates the system to buffer against overactivation, leading to calming, anxiolytic, and potential antipsychotic effects. Cannabinoids have shown promise in treating various medical conditions. Clinical trials have demonstrated the efficacy of cannabinoids in managing chronic pain. They have also been used to alleviate nausea and vomiting associated with chemotherapy. Additionally, cannabinoids have shown potential in reducing muscle spasticity in patients with multiple sclerosis. Furthermore, research suggests that cannabinoids may have neuroprotective properties. They could potentially be used to treat conditions such as Alzheimer's disease and Parkinson's disease. However, more research is needed to confirm these findings.
Chronic pain is a significant health issue affecting millions of people worldwide. For many, this pain is not just a physical burden, but also an emotional and psychological one, impacting their quality of life and daily activities. Traditional pain management strategies often provide limited relief or come with undesirable side effects. These can include dependency, gastrointestinal issues, and even the risk of overdose. Many patients find themselves in a cycle of trying different medications, only to experience minimal relief and significant side effects. Cannabinoids, particularly CBD, have emerged as a potential alternative for pain management. CBD is non-psychoactive. It does not produce the high associated with THC. CBD is believed to interact with receptors in the body's endocannabinoid system involved in pain perception and inflammation. Studies have shown that CBD can effectively reduce pain associated with conditions such as arthritis. Similarly, CBD has been found to alleviate back pain, whether it's due to injury, poor posture, or chronic conditions. Nerve pain, or neuropathy, can be particularly challenging to treat, as it often does not respond well to conventional painkillers. Unlike opioids, CBD is not addictive and does not produce the same psychoactive effects as THC. This makes it a safer option for long-term use.
Cannabinoids have shown potential in managing symptoms associated with neurological disorders. For example, Epidiolex, a CBD-based medication, has been approved by the FDA for treating certain types of epilepsy. This groundbreaking approval marked a significant milestone in the medical community, offering new hope for patients who have not responded well to traditional treatments. Studies have shown that CBD can reduce seizure frequency and improve quality of life for patients with epilepsy. Additionally, cannabinoids have been investigated for their potential in managing symptoms of multiple sclerosis, a chronic condition that leads to a range of debilitating symptoms that can significantly impair daily functioning. Research suggests that cannabinoids may help reduce muscle spasticity, pain, and bladder dysfunction in MS patients. Emerging studies suggest potential benefits for conditions such as Parkinson's disease and Alzheimer's disease, largely because cannabinoids exert neuroprotective and anti-inflammatory effects and help modulate glutamate and GABA neurotransmission. However, more research is needed to determine the long-term efficacy and safety of cannabinoids for these conditions. Challenges include inconsistent study results, psychoactive risks with THC-containing therapies, and the lack of standardized dosing. Ongoing studies and clinical trials are essential to fully understand the potential and limitations of these promising treatments, ensuring they can be safely and effectively integrated into medical practice. While cannabinoids offer potential therapeutic benefits, it is essential to be aware of the potential side effects and risks associated with their use. Common side effects of THC include dry mouth, red eyes, increased appetite, and impaired coordination. High doses of THC can also cause anxiety, paranoia, and hallucinations. CBD is generally well tolerated, but some individuals may experience side effects such as fatigue, diarrhea, and changes in appetite. It is important to note that cannabinoids can interact with other medications via the CYP450 enzymes.
The legal status of cannabis and cannabinoids varies widely across the globe. In some countries, medical cannabis is legal, while in others it remains strictly prohibited. In the United States, cannabis remains a Schedule I controlled substance at the federal level. It is essential to stay informed about the laws in one's jurisdiction. Despite growing interest in the therapeutic potential of cannabinoids, more research is needed to fully understand their mechanisms of action, long-term effects, and potential risks. Clinical trials are ongoing to investigate the efficacy and safety of cannabinoids for various medical conditions.
In conclusion, the endocannabinoid system offers powerful insights into the practice of psychiatry. Cannabinoids have emerged as a promising area of research in medicine. From pain management to neurological disorders, cannabinoids offer a potential new frontier in therapeutics. ECS-targeted therapies open new doors for treating mood disorders, PTSD, addiction, and more. The growing body of evidence suggests that cannabinoids may provide relief for patients suffering from various conditions. However, precision targeting remains key to maximize benefits and minimize risks. As research progresses and the legal landscape evolves, and as public interest and therapeutic potential continue to rise, the need for evidence-based clinical guidelines, standardized formulations, and responsible policymaking becomes increasingly urgent.